Hello, I'm Chris Gaster, the Assistant Vice President of Outpatient Cancer Services at Avera McKennan. I oversee the Avera Cancer Institute. Both Avera Cancer Institute and Avera McKennan are a tertiary and quaternary referral center for the Upper Midwest. At the Avera Cancer Institute, we have 52 infusion bays and do approximately 250 chemotherapies per week. The project that we embarked on, called Rural Chemotherapy, was very important to us because part of the Avera McKennan philosophy is providing care close to home. We want to ensure that patients receive the highest quality of care regardless if it was here at the Avera Cancer Institute or in their local community. Through a series of questions that we received from the rural chemotherapy sites, we began to understand that there might be some standard of care concerns. By working through our Physician Cancer Leadership Committee, they gave us permission to proceed on developing standard guidelines that we would be able to issue out to the rural sites.
As part of the Rural Chemotherapy Project, our pharmacists reviewed national standards for safety for the patients, as well as safety for the employees preparing it. We collaborated with other leaders in the checklist that rural chemotherapy sites needed to review and comply with in order to meet national standards. One of the requirements for our outreach facilities is that those individuals preparing chemotherapy would complete a chemotherapy course. At the Avera Cancer Institute, we have required our employees who prepare chemotherapy to demonstrate competency through utilization of a chemotherapy kit. We felt strongly that those individuals out in the rural setting and in rural facilities should also complete a similar competency to demonstrate their knowledge base of preparation of chemotherapy products.
As the Director of Environmental Safety, my responsibility in this project was to make sure that we were following the OSHA requirements for hazardous materials. We needed to make sure that all of our sites were following the requirements for personal protective equipment, which means that they had to have appropriate gowns, gloves, face protection, whatever was required for the particular area in which they were, whether they were preparing the medication, administering it, or cleaning up afterwards.
My role in the Rural Chemotherapy Project was to assist in frontline staff communication, also bring the element of the specializing oncology nursing requirements. Rural Chemotherapy Project really allowed our patients to stay in their home site, feeling safe under the Avera Cancer Institute standards of administration, giving them the same quality of care, and allowing them to be supported by their loved ones. The Avera Cancer Institute would like to thank the ACCC for acknowledging our facility and the Rural Chemotherapy Project.